This is Dr. Payam Sabetian from the American Hip Institute, presenting our paper on favorable and durable outcomes at 10-year follow-up after endoscopic gluteus medius repairs with concomitant hip arthroscopy. This study was performed at the American Hip Institute Research Foundation and is being presented at AANA 2024. These are our disclosures. Gluteus medius tears have been historically misdiagnosed, but have been proven to be an important cause of hip pain and impairment. Studies have demonstrated that endoscopic surgery is an effective treatment of abductor tendon tears. However, to the date, literature is lacking long-term outcomes after this procedure. Therefore, our objective was to present patient-reported outcomes at a minimum of 10 years. So the purpose was to evaluate 10-year patient-reported outcome scores following endoscopic surgery for gluteus medius partial and full-thickness tears with concomitant hip arthroscopy for labral tears and or FAI. We collected the data prospectively for our patients for a minimum of 10 years. And the included patient-reported outcome scores were the modified Harris hip score, the non-arthritic hip score, the hip outcome score, sport-specific subscale, and the visual analog scale score for pain. We indicated surgery if our patients had symptoms that were over 3 months, if we had an MRI-confirmed tendon tear with or without fatty degeneration. We failed conservative measures of treatment, which included physical therapy, and whether we had an endoscopic confirmation of a tear and amenable to repair. The technique varied depending on what was found on the diagnostic endoscopy. If partial thickness tears were found, either a transtendinous repair or a suture staple technique were performed. And if a full thickness tear was found, which was non-retracted, then a double row suture bridge technique was performed. We found from 13 patients whom were eligible, 11 of them had a 10-year follow-up with a mean of 127 months. The group consisted of 10 females and 1 male, with a mean age at surgery of 60 years. Importantly, of our patients, none of them required future reoperations or reached endpoints. So we did have 1 patient who required a total hip replacement. However, during the procedure, the repair of the abductor tendon was revised, and the patient did not require a secondary repair. So all of our patients' PRO scores were improved with statistical significance from a preoperative to post-operative measurements, and maintained their improvement to a minimum of 10 years of follow-up. The mean satisfaction rating was 8.3 at the latest follow-up, and we had patients achieving PASS and MCID for the modified Harris hip score in HOS SSS at a rate of 81.8%. Some of the strengths of our study were that we utilized validated outcome scores. This is a 10-year outcomes study with data that was prospectively collected. We did have some limitations, for example, not having a control group, a single center, single surgeon study, and also that there was a lack of information of hip abduction strengths at the latest follow-up for some of our patients who collected the data through a phone call or email. In conclusion, our endoscopic repairs of the gluteus medius are a safe procedure with favorable and durable outcomes at a minimum of 10 years of follow-up. Thank you.